Mullerian agenesis, also called MRKH syndrome, is a condition where a person who has typical female chromosomes, XX, is born without a uterus and the upper part of the vagina. The ovaries, breasts, and external genitalia look normal, so the body makes female hormones and develops pubic hair and breasts just like any other girl. Think of it as a house that has all the rooms except the main bedroom. The rest of the house works fine, but that one important space is missing. The exact reason why MRKH happens is still not fully known. In many cases, it seems to run in families, suggesting a genetic link. Scientists have found changes in some genes such as WNT4, HNF1B, and LHX1 in some patients, but most people have no clear genetic marker. There is no evidence that diet, lifestyle, or infections cause the condition, so it cannot be linked to something a mother did or did not do during pregnancy. The most obvious sign is primary amenorrhea. The person never gets a menstrual period, even though puberty progresses normally. Other clues include fully developed breasts and normal pubic axillary hair, a shorter or absent vaginal canal that may cause discomfort during a pelvic exam, occasionally urinary tract anomalies, like a kidney that sits lower than usual. A simple way to picture it: imagine a girl who grows tall and strong, but when she looks in a mirror she sees there is no room for a period to appear. Doctors start with a careful medical history and a physical exam. If the vagina feels shorter than usual, they order imaging tests such as ultrasound or MRI to see the internal organs. Blood tests check hormone levels to confirm the ovaries work normally. Treatment focuses on two goals: creating a functional vagina. The most common method is a step-by-step vaginal dilation program, where the person gently uses a series of graduated plastic dilators at home, like stretching a piece of dough. If dilation does not work or is not preferred, surgeons can create a neovagina using tissue from skin or the bowel. Future fertility: because the ovaries produce eggs, a woman with MRKH can use IVF with a surrogate mother. The eggs are retrieved, fertilized, and implanted in another woman's uterus. Support from counselors and peer groups is also an important part of care. Since the cause of MRKH is largely genetic and not linked to modifiable risk factors, there is no specific way to prevent it before birth. What can be done is early awareness, teaching teenagers about normal puberty patterns so that a missing period is noticed early and evaluated promptly. Early diagnosis helps reduce anxiety and allows timely counseling and treatment planning. Research over the last few years is moving in exciting directions. Genetic studies are using whole exome sequencing to find new gene variants that may explain more cases. Uterine transplantation trials, already successful in a few countries for women without a uterus, are being explored as a potential option for MRKH patients who want to carry a pregnancy. Tissue-engineered vaginas grown from a person's own cells are being tested in laboratory models, aiming for a less invasive way to create a functional vaginal canal. Improved dilation protocols with mobile apps that remind patients of schedules and track progress have shown higher success rates and better adherence.